Common positions used for repositioning patients are supine, Fowler's, lateral, Sims, and prone positions. In this slideshow, we'll focus on supine and Fowler's positions. The most common sleeping position is the supine position, where the client is lying flat on their back as demonstrated in the image above. Pillows or wedges can be placed on each side of the resident to promote comfort, or to support a limb that is immobile or has impaired function. A pillow should also be placed underneath their calves to keep their heels off the bed and prevent pressure that can cause pressure injuries. This pillow placement under the calves is often referred to as floating the heels. After repositioning the client, the NA should be able to place their hand underneath the client's heels to verify there is no contact by the heels on the mattress. If a resident is highly susceptible to pressure injuries of the heels, they may have specialized soft foam boots, as illustrated in the image above, that support the ankles and keep the heels floated off the bed. A foot cradle may also be used to keep sheets and blankets off the tops of the toes, if the resident has a history of skin injury in that area. In Fowler's position, the client is lying on their back with their head elevated between 30 and 90 degrees, as illustrated in the image. Residents should be placed in Fowler's position anytime they're eating or drinking or when oral care is provided. Fowler's position is also used to increase lung expansion for those with breathing difficulties, such as those that occur with heart failure. It may also be used for comfort during leisure activities, such as watching television or reading. Additionally, residents receiving tube feeding should never have their head placed below a 30-degree angle, because this can cause aspiration of the fluids. However, Fowler's position increases the risk of friction and shear on the coccyx and gluteal muscles as the client slides down in bed. This risk can be reduced by concurrently raising the lower portion of the bed, or by putting multiple pillows below the lower legs. These actions bend the knees and reduce the pull of gravity that causes the resident to slide down in bed. A pillow can also be placed below the feet to prevent them from contacting the foot of the bed.